This morning, the Apostolic Nuncio Emeritus, Archbishop Augustine Kasujja, joined the community of Serenity Center as they marked the 24th anniversary of providing biopsychosocial and spiritual therapeutic services, celebrated the Feast of Saint Monica, and launched activities leading up to their Silver Jubilee celebrations.
2, 1! Thank you. Congratulations, Serenity Center, for reaching 24 years.
The day's multiple events were preceded by the sacrifice of the Holy Mass, during which Archbishop Kasujja decried the unprecedented rise in drug abuse in Uganda, noting that it has contributed to poor academic performance among the learners, and in some cases, school dropouts.
Nearly 1 in 4 Ugandan adults lives with a mental disorder, most commonly depression and anxiety. And that the situation in schools is alarming because studies show that 17.6% of school-going children struggle with depression, accompanied by increasing rates of anxiety and insomnia. That perhaps is the one of the reasons behind the growing number of dropouts in our schools. I know one student who studied that aspect, the dropouts in the schools of Uganda. He was going around different schools, different regions of Uganda. How many children begin school and do not come to the end? Begin primary school, do not end this primary school. Begin the secondary school and do not come to the end. Begin the university and do not come to the end. The dropout.
Urging the congregation to emulate Saint Monica, he called on all stakeholders to raise the occasion and rescue the situation. This comes at a time when Uganda, according to a World Health Organization report, has only 1 professional psychiatrist for every 1 million people with mental disorders. Meanwhile, alcohol addiction among Ugandan youth stands at 51.4%, higher than the sub-Saharan region average.
This mental health crisis is compounded by substance use among young people. The lifetime prevalence of alcohol use among Ugandan youth is 51.4%. significantly higher than the sub-Saharan African average, according to Kutesa. Among adolescents, boys and young men, illicit drug use in the past year stands at 11.1% and soars to nearly 33.8% among those out of school, underscoring the link between educational exclusion and substance misuse.
Against this background, the Wakiso District Chairperson, Dr. Matia Rwangabwanika, proposed that the government extend support to institutions providing rehabilitation services for victims of substance use disorders.
As technocrats, I would kindly request you that we strike a deal of looking at that principle of subsidiarity to see how best the government can help this facility. Because my experience was that the services are very expensive, not out of making profits, but they are expensive because of the drugs and everything they use to serve us. And I would request that if we strike a deal and we work with, my office works with you, the commissioners, now the NDA, and we engage the powers that be to see to it that they come in and assist this facility, because there is no client here who is private. The facility is private, but the clients are public clients. And they are our responsibility, because welfare of the citizens we lead is part of our mandate as leaders.
Similarly, Dr. David Basangwa, a founding member of Serenity Center, urged the government to complement existing laws with more stringent preventive policies, particularly targeting alcohol regulation among minors. He recommended abolishing the packaging of alcohol in small bottles.
What still remains, and what I want to appeal our leaders in a special way, is also to look at alcohol as a burden in our country. A lot of young people, actually the majority of people that struggle with addiction in our communities are using alcohol. But we've probably not done enough. I know something has been done, but we can do more in terms of reducing the harm that is caused by alcohol in this country. We need proper laws, we need proper policies to be able to control the issue of widespread availability of alcohol, work on issues of packaging. You know, the packaging, previously government in a way reduced on the use of sachets, but still we have concerns that the small bottles are as good as sachets. So if we can in a way also look at a measure to reduce onto these small bottles, which are easy to conceal, they can be pocketed, they are cheap, so anyone can afford them, and they also, by the way, work negatively on our environment because they are littered all over. So it's my appeal to government, I think, to take on this challenge so that we can have a healthy population.
Dr. Hafsa Lukwata, the Minister of Health's Assistant Commissioner for Mental Health and the Control of Substance Abuse, acknowledged enforcement inconsistencies in anti-narcotics laws, but stressed that responsibility must also lie with members of the public, who should work in hand with the authorities to eliminate illicit drug consumption.
As government, we are supposed to write policies, laws and guidelines. We have written these laws and they are very beautiful. Our only problem is the enforcement. And of course the enforcement has to be done by everyone in the communities. We have the anti-narcotics law. It is coming into force. It has come into force already. It came into force in April. But it's prohibiting the use of substances like cannabis and so on. We are not supposed to be found with cannabis. You're not supposed to be found with any drug, with any narcotic on you, unless it is a prescription by a doctor. But we see most of these people, our friends, our colleagues moving around with these things, and we do not. I mean, it's up to us as communities to actually educate them and to emphasize and to teach them that they're not supposed to be using these substances.
We are doing our part. We are controlling entry, controlling access, and we're also controlling the quality of what comes in. Some of the drugs that are being abused are being mixed with so many things. So when we find them, we find that they've mixed so many things, and some of those, the quality is not usually very good. And that's what the young people are looking for, to get them a bit high. So we are doing the control, and most importantly, we are also reaching, like Dr. Hasfa has indicated, we are reaching out to the community, and we are telling them it is wrong to abuse these drugs. Please stop or prevent, or don't even try.
In the same spirit, Lukwata issued an emotional appeal to mothers across the nation, urging them to desist from alcohol consumption, warning of its grave reproductive consequences.
So we are seeing an increase in number of women who are using alcohol, and of course that is going to affect the quality of family that these people are going to run. We first of all know that many women, like when you take alcohol as a woman in your reproductive age, your chances of getting a child who will be negatively affected by your alcohol are very high. We are seeing these days a trend where people are taking wine, and they call it kawaini. I'm taking kawine. It's just a kawine. But the concentration of alcohol in that wine is quite high. So for the ladies who are pregnant or planning to become pregnant, once you start taking wine or alcohol generally, you're putting yourself into trouble because your child may get affected by this alcohol.
In this context, the administration of Serenity Center has taken it upon itself to empower and nurture women to recover from drug addiction by launching activities in preparation for their Silver Jubilee celebrations slated for August next year.
Therefore, Serenity Center is driving to strengthen integrated care for women with an exclusive women's residential unit managed by a dedicated female staff and specialized programs designed specifically for women's needs to address more women accessing mental health care. Number 2, safe care environment for women. And of course, when I talk about the safe care environment, women will know what I'm talking about. So the 25th anniversary theme honors the struggles and resilience of women, and is dedicated to highlighting their experience and struggles in addiction rehabilitation.
Commonly abused substances in Uganda include alcohol, cannabis, kati, commonly known as amairungi, prescription drugs, and increasingly synthetic narcotics. Its availability, unemployment, peer pressure, and lack of awareness about the dangers of drug use have fueled the problem. The consequences are far-reaching, ranging from school dropouts, mental health disorders, and increased crime rates to strained family structures and reduced productivity. Joseph Kabale, UCTV News.